I'm Sarah Edwards. I'm a level 2 BSc nursing student at Conestoga. Today I will be your nurse. So if I could just ask your name. Okay, and your birthday. Alright, so I'm just making sure that this matches with the wristband. And perfect, it does. Okay. So like I said, today I will be your nurse, and I will be performing an indwelling catheter because you are complaining about pain in your abdomen and you feel the need to urinate, but you cannot urinate on your own. So we will be inserting an indwelling catheter to help alleviate the pain. The indwelling catheter will help empty your bladder. So do you have any questions or concerns before we start? No? Okay. All right. So I'm just going to go grab all my things and I will be right back. All right, so I'm just going to lay this underneath you. It's just an absorbent pad, making sure that we don't get any spills or anything on your bed, like so. Perfect. So now I will be doing perineal care, and by doing so I will have clean gloves on and I will be cleaning the genital area with soap and water. So by doing this, I would be holding with clean gloves in one hand. I would hold the labias apart. With soap and water, I would go left, right, down the middle, and I'd be going from an anterior to posterior direction. Okay, so we will be performing the indwelling catheter now. So to get started, I will cover you up appropriately. And I will prepare my sterile field. And I want to make sure that you're in a dorsal recumbent position. So you'll be lying on your back with your thighs spread out and your knees up a little. Let me throw this in my garbage. Okay. So I will be using this to cover your genital area. Like so. Taking this out and I will be placing it shiny side down. Like so. You also want to make sure that the bag that you will be attaching the catheter is on the bedside, either hanging off the rail or hanging off the side of the bed. You want to make sure that the bag is below the level of the bladder so we don't have backflow going back into the bladder. And you also want to make sure that the bag is not touching the floor. Perform hand hygiene. Alright, so now I will be opening up my sterile gloves. So then you're going to open up your catheter and drop the catheter on the sterile field. to take everything outside, that's inside, outside. I will not be using this. You want to make sure that it's all within the 1 to 2 inch sterile field. And just to make it easier, the inside is sterile, so with my sterile gloves, I will be lifting this and placing it right here. Still making sure that everything is within the 1 to 2 inch margin. All right. So you want to open up the lubricant and pour it just inside. Discard this in your garbage. And then you want to make sure that the tip of the catheter is in the lubricated fluid. You can just leave it there. And then these cotton balls, you're going to want to cover them in this antiseptic solution for cleaning. You can throw this in the garbage and pour this over. With your non-dominant hand, you're going to want to separate the labias, and once you touch the labias, this hand is then contaminated. So then with your dominant hand, which is not contaminated, you are going to be picking up tweezers, taking cotton balls, and doing the exact same motion as done before. The left, right, and then down the middle, a cotton ball each time, and then throwing those in the garbage as well. And you want to go from anterior to posterior. And then down the middle. And then with your dominant hand, you are going to be inserting the catheter into the urethra. You want to be inserting at 2 to 3 inches or until you see urine. If you do have any resistance, just ask your patient to take slow, deep breaths to help relax themselves, and it'll be easier to get in. You want to make sure that you're holding the labias open, because once they're closed, then all the area around it will be contaminated and you will have to do this all over again. For adult patients, you want to use a size 14 to a size 16 catheter. And you want to use the smallest size possible, just so that there won't be any trauma or damage to the urethra. So I will be using a size 14. All right. Okay, now that the urine is coming out, with my still contaminated hand, I want to use this syringe and connect it like so. And then to inflate the balloon, I will just be pushing the fluid inside the syringe up. The balloon helps keep the catheter in place. And then you want to slowly just kind of pull it out a little until you feel the resistance, just to make sure that the balloon is fully inflated. And then you'll push it back up just a tiny bit more. All right. And then you want to connect your catheter to the bag. And then the urine should just collect within the bag on the bedside. And then you can remove your gloves. And then perform hand hygiene with soap and water. Hi, Mrs. Mancini. It's been 36 hours since your indwelling catheter has been placed. And we're now going to disconnect you from the catheter. And we're going to try to encourage you to void on your own. So when the bag becomes full, what you're going to want to do is you're going to want to empty it, and you want to do this to prevent any backflow, which can cause infections and many other conditions that we want to try to avoid. So when your bag is starting to get full, this is what you're going to do. So you're going to unclip this. And then this is closed, nothing is going to be coming out. And then you're going to want to get like a graduated cylinder or something else that has markings because the bag can sometimes be unreliable. So you're just going to want to empty that into a graduated container. And by doing so, you're just going to press down on this, open it up, and then all of the urine will fall within the graduated cylinder. Alright, so to discontinue a catheter, you're going to need clean gloves, the tray, as well as the syringe, and you're also going to want to know the amount of fluid that was pushed up to close the balloon. In our case, it was 10 milliliters, so we will get a syringe that can hold 10 milliliters. So with your clean gloves, you're going to place those on like so. And then you're going to want to connect the syringe, and then with force, it should just, like the force should just push it back down. And you want to make sure that you get all 10. Perfect. And then you're going to slowly, with your dominant hand, you're going to want to slowly pull out, and if you feel any resistance, then you're going to want to once again try to get as much out. We want to cause as less damage as possible to the urethra. So you're going to slowly pull out, and then you're going to coil it around your finger. And then you're going to place it inside this container, disconnect it from here, and then you're going to just want to discard this. So Mrs. Mancini, we're going to try to get you to void on your own. So if you do feel the urge to void, just let one of us nurses know so we can help you get to the washroom, ambulate to the washroom, as well as we want to measure your urine with either like a hat placed on the toilet, or we can use a commode or bedpan depending on the situation. And you also want to tell the patient that when they first void after the catheter is removed, that they could feel any burning or any pain, which is typically normal when you remove the catheter. However, if they have a temperature, if they have a fever, any other signs or symptoms that are abnormal other than the burning urine, you want them to let you know right away, because that could be a sign that an infection occurred while the catheter was inside.